So let's start this session. So the reason why we are taking this session is quite evident. All of us know that NEETPG dates have been announced, and we know that it's 3rd of March. It's 3rd of March. So I'm sure many of you must be feeling a bit anxious. Getting to know that you are preparing for an exam is in itself stress inducing, but when you are given a date that this is the date, that this is when it is going to happen, it increases anxiety further. So I'm sure now it all has become real, and we have to be very careful in what we do in these days. So I thought that let's have a session and finalize the approach, discuss the approach, and some part of this session would be applicable to everybody, whether you are studying from, whatever platform you are following. This session, a part of it would be applicable for everyone, and then I'll discuss what we have planned, and we'll discuss the details of it. So students, this is something, the first part is something which I don't need to stress upon further. The stakes can't be higher. I often say that whatever is going to happen between this INICT and the NEETPG, whatever you do this in between these two exams, whatever you do in the remaining 100 or 111 days, it's going to stay with you for the rest of your life, right? It's going to stay with you for the rest of your life. We, the professionals, when we have become doctors, when we are practicing, whenever we meet somebody new and we get to know that he's a doctor, the first question that we ask him that in which branch do you practice, or in which branch are you in? And the second question that we ask is from where did you do your MBBS or MD, right? So no matter whether you are 40 years old or 60 years old or 35 years old, these questions stay with you for the rest of your life. And finally, where we end up, it's not entirely in our hands, but the effort that we are going to put in these 3-4 months is in our hands, and it's going to have a direct impact on what is going to get attached to our names for the rest of our lives. So it's very important that we realize that the stakes cannot be higher. It's huge. Whatever you do in these 3-4 months will decide what branch you get into, and that branch that you get into is going to stay with you for the rest of your life. So I know it's a cliche that we keep on saying the same thing कि 10th कर लो इससे बड़ा कुछ नहीं, 12th कर लो इससे बड़ा कुछ नहीं, PMT कर लो इससे बड़ा कुछ नहीं. But यहाँ पे तो सही में whatever you're going to do is going to stay with you. So I don't have to emphasize it further. You know it, but it's good that you remind yourself again and again that pardon my French, but that the shit just got real. Now what is happening is going to have a huge impact. This is another thing that I love discussing with my students. When we get more mature, when we get older, when you get into your mid-30s or 40s or even later, you always remember certain things from your academic career. You always have a story to tell. Like I have multiple times told my story of how I got only 40 days and how I managed to crack the examination. That story remains with me. That story kind of defines some part of me. And the same is going to happen with you, right? Whatever you do in these 3.5 months is going to stay with you. If you get a great result, if you get a good rank, if you do something phenomenal, for years to come, you will discuss about the same thing again and again. Your juniors will come to you, your family members will discuss with you, your friends will discuss with you. That story is going to remain with you. So while you are watching this video, at this point of time, a story is being written. Your story is being written. Ensure that it's the best version possible. And sometimes motivation appears to be a bit dramatic, but see, it is dramatic. If something is going to have such a huge impact on your life, it has to be emotional, it has to be dramatic, it has to come from within the heart. So it's not just another exam, it's going to stay with you, and ensure that the story that you're going to write is the best version out there. And when I talk about best version, it is often hidden. What do I mean by the fact, by the phrase that best version is hidden? We, all of us have, our own assessments. We know in our own head how good a student we are. We also have some kind of numbers in our head that this is how much I can study. this is what I can do. All of us, if you ask anybody, usually he'll say, sir, I'm an average student. I can study for only 7-8 hours. We carry those images in our head, and often those images are false. Often we don't even realize what we can actually do. And the reason why I talk about this again and again is because it happened with me. I always considered myself to be a good student when I was a student, but I never knew that I could ever cross, those benchmarks of 11 hours of studying of 11 hours a day or 12 hours a day. When I started preparing for my NEET PG examination, it was not NEET PG, it was Delhi PG, by the way, when I had like 40 days left, then that was the first time I realized that I could actually really push the bars. Till that time, I was not even aware. And the same is applicable to you. You might have certain notions about yourself that I cannot study beyond 6 hours or 8 hours, or I cannot do this or I cannot do that. But perhaps you are wrong. When you start doing it, when you get totally preoccupied with it, when that desire is all encompassing, it's the only thing that you can think of, then strange thing starts happening. You see that you are breaking your own records. You see that you are not really getting that tired. You realize that you can retain stuff, but can you get into that zone? It's all about getting into that zone. And we have to get into that zone given that we just have 110 or 11 days left. Students, often when I discuss about these things, the first thought that comes in the mind is, but sir, only 3.5 months are left. अभी तक तो बहुत अच्छे से किया नहीं, उसका क्या होगा? See, whatever happened till today does not matter. In an entrance examination like NEET PG, in an entrance examination like NEET PG, in a PG medical entrance examination, the end is always going to be much, much more important than the initial journey. Why? You do whatever you want to do, facts would be very important in our exams. Facts are always going to be very important in the exam. Your brain has limited capacity. You keep on complaining that sir, I read this, then I forgot this. Of course, it's going to happen. Your brain does not have any unlimited capabilities. You cannot upgrade the RAMs. Your RAMs are limited. So the size is limited. You're putting stuff in it. You will of course keep on forgetting things. That's a sad part, but it also opens up opportunities. Why? Whatever happens in the end is going to stay fresh in your head. In the last 10 years of my teaching, I have come across so many examples where people started very late, but did fantastically well, put a huge amount of effort, and they got a great rank. It might be a bit unfair also. Of course, you want the guy who is starting from day one should have an advantage, and he does have an advantage. She does have an advantage, but the last months are going to be important for the simple reason that our exam is quite fact-based, and the limited capability of brain always comes into play. So whatever happened till today, it's important, but it's not going to be defining. It's of course important, but it's not going to be defining. If you are somebody who is going to start from today, believe you me, if you can follow the things that I'm going to discuss, if you can play the game right, nobody can stop you from getting selected. Not only from getting selected, but from getting a great rank. But करके तो दिखाओ. This is the time when you have to challenge yourself. Life में एक तो time ऐसा आना चाहिए जब आप अपने आप से बोलो कि यार ये तो करना ही है. See, we say that being stubborn is not good, but then when it comes to entrance examination, being stubborn is great, right? Getting up every day in the morning and saying करना ही है. एक दिन खराब चला गया, you could not study for a day, you could not study for 2 days, you're feeling bad, but telling कि करना ही है, right? When you get into that mood कि करना ही है, तो फिर वो हो ही जाता है. जिसने ये बोल दिया करना ही है, उसका हो ही जाता है. If you commit to yourself that you have to do it, it will happen. It's as simple as that. But that's a difficult thing to do. The question is, can you do it? And if you do not do it now, then when? If you are not going to do it now, then when? There has to be a time in your life when you say that I am going to go all out. Whatever, every ounce of energy that I have, I'll spend it out there. Isn't this the time? If not this time, then when? This is the whole question. If not now, then when? And if not you, then who? आप नहीं करेंगे तो कौन करेगा? So guys, I cannot stress it more. These months are going to be defining, and you have to ensure that आप जो भी करने वाले हैं वो exceptional हो. If you can pull out an exceptional effort here, you will get an exceptional result also. ये दुनिया का नियम है, ये जीवन का नियम है. ऐसा ही होता आया है, ऐसा ही होता रहेगा. Alright, I'm a big fan of MSD approach, Mahendra Singh Dhoni approach, and I have repeated it multiple times, half the game is won. Half the game is won when you take it to the last day. Dhoni was such an exceptional captain. He was such a great match finisher. Why? Because he would just, stick in there. He would, even the run rate is going up, even the bowling is difficult, but he would just ensure that he stays there till the end. If you can take the game till the end, the game is half won. So in your case, you have to take the game till 2nd of March. You have to take the game till 2nd of March. If you are somebody who started early, it's even more important for you, because people who are starting late, they have a disadvantage that they have lesser time, but they have an advantage that they are not tired. Somebody who started in the beginning may get that thought that I am too tired. Ab mujhse nahi ho raha. This thought, ab mujhse nahi ho raha, is the most damaging thing that can happen to you. Energy leeches are out there. In every batch, in every reading room, in every library, there is one energy leech who says कि यार बहुत पढ़ लिया, अब उससे नहीं हो रहा. Enough is enough, I can't do more. And he ensures or she ensures that he or she says this thing to everybody. When you listen to that statement कि मुझसे नहीं हो रहा, psychologically you also start feeling कि यार मुझसे भी नहीं हो रहा. Immediately you start feeling that even I can't do it. Please stay away from energy leeches. If somebody tells you that it's no longer possible, or I'm tired, how are you studying, I can't study, just don't talk to them. Probably they are not doing it willingly. Probably it's not a strategy that they are pursuing. It's not that they are bad people, but some people by default, the temperament is such that, the personality is such that they keep on saying these things, and they don't even realize how that impacts other people, how it impacts adversely the other people. Right guys, so this has to happen. Very important, 110 days. And while I was preparing the schedule, I just looked at the calendar and see, this time the Feb is going to have 29 days, right? You have been given 1 day more by the nature, by the Almighty, right? So maybe somebody up there wants you to get selected this time. All right, talking about the specifics. So if you want to get selected in the PG entrance examination, two bases must be covered. The grip on the conceptual topics has to be strong. The grip on the conceptual topics has to be strong. Why? You cannot, remember all the facts. Again, it's difficult. Why? The same thing, your brain has limited capabilities. So you cannot just memorize everything. The conceptual topics must be understood properly, so that by logic you are able to answer those things. Probably conceptual topics would cover like 60-65% of your course, or 70% of your course. At the same time, you have to ratify your way through the factual topics. There are certain things that have to be remembered. There is no other way, right? If I tell you that clozapine is an important drug, and I tell you there are 3 important side effects. One is granulocytosis, second is myocarditis, and third is the seizures. This is a fact. You have to remember it. But then I tell you that because clozapine can cause granulocytosis, that is why when the patient is on clozapine, you have to do blood monitoring once a week initially, then once in 2 weeks. This blood monitoring part is again a conceptual part. You have to remember the fact, but the second part becomes a concept. If you know this fact, this concept is easy to remember. You don't really have to remember the other thing also. So a combination of concepts and facts is what it's going to take you through it's going to get you a good rank. So we have to give importance to both these things. There is no other way. If you think that only concepts can help you pass the examination, not going to happen. If you think only facts can help you get pass the examination, again, not going to happen. There has to be a balance. There has to be a combined approach. PYQs, PYTs. Again, every single teacher that is, a faculty in PG entrance examination would tell you the importance of these previous year questions and previous year topics. The problem is, the mistake that many of us do is we keep on postponing them. We keep on thinking कि PYQs तो करने ही है. We have to do PYQs. Let's finish other things, and in the end we will do PYQs. And in the end, the time is not left. My dear students, availability of content is not the rate limiting step. It's not the limiting step. Probably if 10 years back, we did not have any content to study from. We had certain books, and that is what all we had. Today, there's a excess of good content. Great content is everywhere, right? But something that has not changed is the time that is available to you. So you have to structure your skill or your preparation in such a way that all these important things are being taken care of as you move forward. So PYQs would always be important. PYTs, we are seeing increasingly that the question comes from the same topic, but you cannot just memorize the question because they will ask something different. They'll make some changes. So the question would again be from the same topic, but it's not the exact same question. So if you're just trying to memorize the PYQ, it might not help you. 10 years back, it used to help. There used to be a book called AAA, Amit, Ashish, Arvind, something. It would have 10-year questions, and some of us would just ratify it, and the same question would come in the examination. It doesn't really work that well anymore. Of course, certain questions come from the same thing, but it doesn't work that well anymore. So you have to be good in PYQs, PYTs. You have to ensure that you are practicing MCQs. When you study, when you read, you get the information. When you practice the MCQs, you get to know about the nitty-gritties of solving the questions, right? Many people talk about the smart approach of answering a question, how to rule out certain options, how to make a good guess. See, how well are you able to make a good guess, or how good your guess is depends upon your fund of knowledge. If you are somebody very knowledgeable, the chances that your guess would be good are very high. At the same time, there are certain things that you learn while doing the MCQs. So we have to do lots and lots of MCQs so that our MCQ taking abilities in itself also improves. And getting accustomed to 3.5 hours exam. If you have not taken a 3.5 hour exam in the entire year, and on the day of exam you are doing it for the first time, you might have some problem. You might have some issue. First is anxiety, right? When you take grand test, you are kind of putting yourself in the same situation. So we have to desensitize ourselves, right? We talk about how to treat phobias. You have to do behavioral therapy. You have to do exposure therapy. The more you expose yourself to the field stimuli, the lesser anxiogenic it becomes. Similarly, you are afraid of exams. The more you expose yourself to exams, the lesser anxious you will become. And it's not a small point. My guess is, I don't have a data on this. My guess is, if you are very anxious on the day of exam, probably you will end up making 5 to 10% more mistakes, the so-called silly mistakes. When you are too anxious, you are not able to think logically. You are totally dependent on the memory. So the logical part starts getting hit. If you're calmer, you don't make those mistakes. So ensuring that you are good during those 3.5 hours is also pretty important. I don't have to tell you that how much difference can these 5 to 10% marks make. You know that it make a difference of thousands of rank. मैं अभी आप लोगों के क्वेश्चंस देखूंगा बेटा, but let me complete this. All right. So enough of theory. How are we going to achieve it? All right. This is a cliche, but there is no substitute to hard work. There is no substitute to hard work. And hard work is, as a psychiatrist, I should not use this word, but let me write it here. It can be addictive. It can be addictive. Just to make a point, right? Hard work can be addictive. Why? See, again, it's very simple. I often ask this question. You say you have 2 days. The first day, you spend 2 hours watching a movie on Netflix. Then you spend 2 hours watching Instagram reels and seeing all those reels, so beautiful, so elegant, looking like a wow, hundreds of times. And then Badal Bijuri or whatever is going nowadays. And then you spend 2 hours watching YouTube shorts, and then you call your friend and again talk for 1 hour. And after doing all this, you study for half an hour and then you go to bed. Do you really feel good? Do you really feel happy? Do you really feel satisfied? Do you even get this feeling that I had fun today? Neither are you feeling happy, neither are you feeling satisfied, nor are you getting any kind of fun. Then how is it a good day? Compare it with another day. You studied for 11 hours in the entire day. You are dead exhausted. You are tired. Your brain is just not working. You are having headache. But you go to bed. You switch off the light. What is the feeling? The feeling is that of satisfaction. In your heart, you know that you did what you were supposed to do. And don't you crave for that feeling? Isn't that what we all crave for? Feeling that I am doing what I am supposed to do. So if you compare both these days, in one day, at least you studied for 11 hours and going to bed with a feeling of satisfaction. In the other day, you are not doing anything and still suffering. then how could it be a good day? You cannot fool yourself. You can fool everybody else in the world. You cannot fool yourself. In your mind and heart, you know what is it that needs to be done. Unless you do it, you would not feel peaceful. The peace will evade you. The peace will be away from you unless you do what you are supposed to do. It may be, it may be pressure. This sentence may increase pressure on you, but this is how it is. We are trying to crack a tough entrance examination. Here we are dealing with the cream of the country. People who get into medical colleges, they are cream, and now you are trying to best them. Of course, it's going to be a pressure situation, but we have chosen it. We are looking for some kind of glory here, and people can make judgments that whether getting into this cycle may be right or wrong, but that is what we have chosen. And if we have chosen this game, we'll have to play according to the rules of this game. And the rule of this game is single. It's a singular rule. And what is that? You have to sacrifice and you have to struggle. Nothing great can come in life without struggling, without having to struggle and making sacrifices. All right, hardcore equation, basic equation. 110 or 11 days are left. The equation remains very simple. You have to study for 10 to 12 hours a day. 9 out of 10 days. You can take a break once every 10th day. And later on it will become probably 14 out of 15 days. Maybe in Feb it will become 14 out of 15 days. All right. We have to take the preparation till the end. I have already said that. We will follow a structured schedule. That will ensure that we are taking care of both the concepts part, we are taking care of the factual part, and we are moving in a right way, not spending too much time on any particular subject, not ignoring any subject, taking care of the concepts part, taking care of the PYQs part. All of that has to be taken care of, and we have to show up daily. Every day we have to have some kind of answerability. We have to have some kind of mechanism which ensures that we do it every day. All right, let's talk about the cerebellum strategy that we have decided. So till now we were having some kind of conflicts in the schedule. We were running our mission NEETPG lectures, which were taken by the subject specialist. Dr. Zainab ma'am was taking BTR sessions. On days there were some kind of conflicts also, the two classes running on the same time, and students were getting troubled what exactly to follow. So after a lot of efforts by Zainab ma'am also and by me also, we finally created a schedule where there are no clashes. Things can go smoothly and we can cover everything that needs to be covered. So here is the strategy. First part is, let's talk about students who have already completed the course. Now, if you are a Cerebellum student and if you have done mission NEETPG lectures, the live lectures that we were conducting, which just ended like a couple of days back, my advice is revise the same lectures. If you have made notes, even better, revise the same lectures. If you have been following the main videos, recorded videos, it could be from Cerebellum or from any other platform, revise from the same source. If you use some other platform for a particular subject, and if you have a good hold on that subject, the best thing to do, the logical thing to do is to revise from there only. See, the more you revise a particular thing, the better it goes in your head. If you have followed rapid revision or quick revision, again, revise from there. You can also do a mix and match. Say you have done some subjects from some platform, some from other platform. Again, for the first step, you just focus on the same thing. It will be easier. It will take lesser time. In case you have not done it, say there are 5 subjects that you have not covered, or say there are 15 subjects that you have not covered, or say there are 19 subjects you have not covered anything and you are starting today. Again, we still have enough time to complete everything. 110 days, 112 days are more than enough to complete everything. In that case, my advice would be use the rapid revision videos or the quick revision videos of Cerebellum and the BTR videos. So again, I was discussing with Zainab ma'am. So what Dr. Zainab has done in BTR is, she has 2 parts. One are the main videos, and then there is something called as BTR bonus. So I went to the content. I feel the main videos of BTR, the recorded ones, initially they were recorded. BTR bonus, I think, came out late. It was the live lectures which are now kept in the app. The main videos take care of probably most of the important topics that were asked in the exams. So my hypothesis is simple. The quick revision videos of Cerebellum will help you take care of that conceptual part so that you are not missing on concepts. BTR main videos will take care of all the factual part and also some amount of integration that Dr. Zainab does it beautifully, right? So we have got both the important bases covered. So this is the first part. You either revise, and if you have not done it, you use the BTR plus quick revision videos to cover a subject. First step done. Then we will have live classes. I'll show you the schedule. We will have live classes. In these live classes, what we will do, we will cover all the previous year topics in a proper structured manner, so that you not only have a quick revision, but wherever you are struggling conceptually or telling techniques to remember, all those things that are done in the class, all of that is done. Once you have completed a subject, attended the live lecture, then we will go to the subject wise test and discussion. Say we are starting with pharmacology. You revise the pharmacology. I'm presuming you did it from GRG sir only. You revise whatever sir taught. Then you did his live class on 2 days. Then we will have a pharma test and discussion, what we call as END, exam and discussion in Cerebellum. When you do END, now you are getting the knowledge of the previous year topics is getting consolidated, and you are having that very important practice of MCQs. These would be live lectures, live discussion would be there. After every couple of subjects, Dr. Zainab ma'am would be taking tests of a couple of subjects put together. I'll show you the schedule. Say medicine, pharma, physio, patho. These 4 subjects are covered. The TND has been done for all of them. Then we have a mega TND. I'm just introducing that word, mega TND, in which questions would be asked from these 4 subjects, and a live discussion will be done by Zainab ma'am, BTR. Then we do grand test, of course, the whole idea of ensuring that you get that feel of 3.5 hour session. And the previous year question you have to do side by side. 5-year questions are extremely important of NEET PG. Now the question that comes again and again is, should I do INICT question or not? It totally depends. If you are somebody who is now revising, you should. If you are somebody who is just starting, maybe focusing more on NEET PG will help you, right? So all of this is customizable, and please don't get into FOMO. Don't think if I leave INICT I would not get selected. My dear students, it's the time which is the limiting factor. Nobody can do everything. ये बात आपको एग्जाम के दिन याद आती है, एग्जाम के दिन समझ आती है. टीचर्स फर्स्ट डे से चिल्लाते हैं, बट स्टूडेंट को लास्ट में याद आता है. Students realize this thing in the end. Please remember, time is the limiting factor here. We have to structure the program in such a way that we reach the examination hall covering most of the things that can be covered. एक रूल है पीजी एंट्रेंस की तैयारी का, 19 सब्जेक्ट 5 साल में भी खत्म नहीं होते, 1 साल में या 6 महीने में क्या खत्म होंगे? You cannot cover 19 subjects in a year or 6 months, right? So we have to do what is the best that can be done. चलिए. All right, now I will show you the exact dates and how are we going to do it. So yeah, this is the final plan. So I am calling it Mission NEETPG last lap. ठीक है, last lap है. We are going to start with, of course, the legendary GRG sir. So pharma. So I have given pharma coverage. We have to cover pharma in 14th, 15th, 16th, 17th. In 4 days we'll cover pharma. These 4 days are to be used to revise from whatever source you studied or cover using quick revision videos plus BTR. Then on 14th and 15th at 5:30 p.m. in the evening, we will have these live classes every day. So from 5:30 to 10 or 9:30 or 10:30, we will do the live classes. On 16th, we will do the subject-wise test. We'll give you questions, there will be live discussion. This is how we are going to start. On 17th, Dr. Zainab is going to cover the integrated graphs. So all the graphs from all the subjects would be covered in this integrated graphs. Then we start with pathology. 18th, 19th, 20th, 21st you have got for pathology. In those 4 days, for 2 days, Spurs sir will come and take the live lectures. 20th, you will have a TND, and then on 21st, Zainab ma'am will take the BTR of histopathology images, right? So everything is going to get coordinated now. While making this thing, I just thought about a phrase that when you follow the schedule, you will have morning to yourself. Your morning are yours, but your evening are ours. the evenings would belong to Cerebellum, because you have to be on the Cerebellum app in the evening session. In the morning session, you have to do the own thing, the revisions and all. So every evening, 5:30 p.m., it's Cerebellum time. Medicine, then we have got physio, then medicine, the big subject. From 27th to 2nd December, we'll try to cover as much medicine as possible. Dilip sir, the exceptionally good faculty, will take 3-day classes, but I understand that it might not be possible to cover the medicine in these 4-5 days. So what I've done is, I have at intervals kept these cover up days. When I say cover up, basically what I mean, whatever gets left, you can cover it up in these buffer days. So cover up days. So again, medicine, self-study, live classes, END, and then Zainab ma'am will take the integrated system BTR. So basically what she's going to do is pharma, path, physio, medicine. She teaches it as integrated systems. So there would be a test followed by discussion. Then we go from medicine to surgical subjects. We have got surgery, and then there is integrated buzzwords in the BTR, ortho, and then radio. And then we have got some cover up days, and then we have got infections, right? So surgery followed by PSM, dermat, anesthesia. Similarly, we'll keep on going forward. And finally, we come to the last round where you study psychiatry, the most important subject out of all the 19 subjects. Everybody knows that, right? Ophtha, ENT, and we finish it, all of this on 2nd of Feb. We finish everything on 2nd of Feb, right? But the game is yet not over. We did this something called as marathon INICT this time, where in 7 or 8 days we covered the entire course, and our students were very happy. It was very exhaustive, very tiring, but it was another feeling. But the mistake that we made was we conducted this marathon INICT till the date of the exam, like one day before the examination we ended. This time we are not going to make that mistake. We are going to give you at least 7 or 10 days before the exam to relax and to study. So on 2nd of Feb, we finished the last lap subjects or last lap classes. From 11th, from 1st to 10th, again you have got some cover up days to cover whatever was left. And then we start the final thing from 11th of Feb till 24th of Feb. So we'll have the marathon NEET PG this time, one class after another, and along with it integrated the final mega sessions of BTR. So students, we keep on saying that study till the last day, take the preparation to the last day. This time you are not going to be alone. The faculties, all of us, are going to ensure that we stay with you till the last day, because we know that that is a game changer. When you have somebody to listen to every day, when there is a schedule, when there is somebody out there who is ensuring that you are being taught, you yourself becomes accountable. You become accountable. So this is our plan for you till the last day, till the 2nd of March. If you are a student of Cerebellum Academy, you don't have to do anything. Just follow the schedule. We have been saying that if you're a premium pack subscriber, we would never charge you again. If you are not a part of Cerebellum Academy, you should ask yourself, why not, right? Why are you making that mistake? Sorry, थोड़ा promotion कर लिया बीच में. लेकिन if you should, I'm hoping that we are good enough that you consider being a part of Cerebellum Academy. Go to www.cerebellumacademy.com, go to plans, find the Mission NEET PG and subscribe it. When you become a part of Mission NEET PG, everything that happens in Cerebellum app, you get access to. Starting from main videos, to revision videos, to GTs, to BTR, to live lectures, to question bank, whatever we do, everything is a part of Mission NEET PG. And because all of you love coupon codes, that's why I have come with the coupon code Cerebellum. The charges are $19,999, and when you use this coupon code, it becomes $18,999. So this is my presentation. I would love to see questions. All right. Yes. Yeah. So those of you who are BTR subscribers, you can also, I think we have come up with a BTR upgrade coupon code. So basically, what does BTR upgrade do? Only for those who are students of BTR, when they apply the coupon code, I think they get a discount of 5K. When you are not a student of Cerebellum, you get a discount of 1K. If you apply BTR upgrade coupon code, you get a discount of 5K. So this is what you can do if you want to cover the whole thing. Chaliye, let's talk about the questions. So, okay, the question of Qbank. So this is an important one. Dekho, as we come closer to the exam, our questions should be as close to the real exam as possible. So if somebody asks me the importance of Qbank in say January or February, I would say, and he's preparing for the next year, I would say Qbank is a very important tool. It really helps you. But as we move closer to the exam, the importance of PYQs and PYTs is much more than the Qbank, right? Students used to do Qbank because it would help in rapid completion of the subject. They did not have the time to go through the main videos again and again. But at Cerebellum Academy, since we are doing so many live lectures and we are doing it, they are concise. So that problem is taken care of. So the main advantage that Qbank used to give, that now we are doing something much better to cover that point. So Qbank, I don't think you have to be too worried about Qbank at this stage. Anyways, you'll be doing the GTs and the test and discussion and the PYQs. So that should take care of it. Sir, live lectures are free for all. No beta, nothing good in life is free. It's all a part of paid package. Yeah, so Shanmukh is saying how to study for 10 to 12 hours a day while attending live lecture classes. So when I say 10 to 12 hours a day, I include the live lecture duration. देखो होता क्या है ना, if you are following a live lecture and it's of say 4-hour duration, the energy that your brain consumes in those 4 hours while you are listening to somebody passively or even actively using the chat, it is much lesser than the effort that you have to put to study for 4 hours on your own. That is why live lectures are so important. It's so difficult not only to maintain the discipline, but also sitting on a stretch for 4 or 5 hours is otherwise very difficult. So when you do these live classes, at least you are ensuring that on a trot 5 hours you are sitting in front of the phone or iPad and completing. So that improves your productivity by many folds. It is difficult for the teacher. Taking live classes is much easier. We get to talk to people and we get some breaks. In such lectures where you are just speaking, it's much more tougher for the teacher, but it's a great thing for student. आपसे कोई बात कर रहा है, कोई पढ़ा रहा है, you are also able to chat in between, you are also able to ask question, you don't even feel alone. और क्या चाहिए आपको? Alright, what about interns with hectic duties? Yes, so whatever I've said makes more sense for people who are just studying, who are post-interns. If you are an intern, the problem with you is that you have lesser time available. The benefit is you are fresher with your final year. So it kind of gets cancelled. So whatever I'm saying, you can divide it by say 2/3. If somebody has to study for 10 hours as a post-intern, maybe 4 hour or 5 hour or 6 hour if possible would do the same thing. Interns में time से ज़्यादा problem दूसरी है. When you're an intern, the problem is the flow. Say you had a 24-hour duty. Say you were studying good, but then you had a 24-hour duty. अब 24-hour duty के बाद getting back to the study mode is difficult. So there, two things are important. First of all, you have to be motivated enough, and secondly, see, this is the benefit of the structure. अगर रात में क्लास हो रही है, तो the motivation required to log on to the lecture and start the app is much lesser than the motivation required to go to the library and open the book. That is why we keep on saying that the live classes can be game changing for people who are struggling with the studies. If you are somebody who is very disciplined, very structured, and you can do it on your own, of course, that's another great way. But how many of us are like that? So so somebody is asking how to concise for the last 10 days. देखो यही है कि whatever is your primary source, keep on adding on that. Whatever you say you have, say you did Mission NEETPG psychiatry lectures and you have some notes. Now you just add on that. When I take a live lecture, add on that. If I take a TND, whatever extra point you get, add on that. Say Zana ma'am is taking BTR, she tells another point, add on that. So finally, a single book starts getting created, and that is much easier to read. It's much easier to revise. And you can also have that color scheme. If something is red, it is something that you can easily forget. So you have to read it again and again. If something is not marked, you don't have to revise it. If something is blue, read it once. ऐसे ऐसे करके ना आपको अपने कोर्स को कंसाइज करते आना पड़ेगा. How to avoid procrastination? Again वही बोलूँगा मैं. If you want to avoid procrastination, get into the habit of this feeling of satisfaction or high. देखो, this is what I say. आप एक बार पढ़ के तो देखो. एक दिन 10 घंटे पढ़ के देखो तो. When you study for 10 hours or 11 hours, the satisfaction that you get, you start craving for it. वो इतना अच्छा लगता है that becomes the driving force. In psychiatry we talk about positive reinforcement. Any behavior which is followed by a good consequence increases automatically. So if I am doing something, it is followed by feeling of satisfaction, feeling of happiness, I am likely to do it the next day again. But every 10 or 12 days you also have to take a break. While pushing yourself hard, you have to ensure you don't burn out. हमें याद रखना है सबसे इंपॉर्टेंट प्रिंसिपल, प्रिपरेशन को लास्ट डे लेके जाना है. कुछ भी हो जाए, दुनिया ऊपर के नीचे हो जाए, हमें 2 मार्च तक पढ़ाई करनी है. ये बात लिखनी है, याद रखना. अपने ड्राइंग, अपने स्टडी टेबल के ऊपर लिख दो, नो मैटर व्हाट हैपन्स, आई एम नॉट गोइंग टू गिव अप टिल 2nd of March. इतना कर लेंगे आप, half the game is already won. Yes, all those lectures that we will take can be seen later on also. We always upload those things in the app and you can watch them later. But देखो, if you miss a lecture, you can always watch it later. But live lecture का basic फ़ायदा ही live देखने में है ना. See, the biggest advantage of live lecture is even if you're in the ward, even if you're doing a duty, and I'm presuming it's not a medicine or surgery duty, say you are posted in the opthal ward. Opthal ward में शाम में क्या ही होता है, right? बस preparation होती है अगले दिन cataract के operation की, और तो कुछ होता नहीं है. So if you have time, those live lectures you can still follow even while sitting in the doctor's duty room. So the live lecture is something that is much easier to follow than sitting in the doctor duty room and trying to study on your own. So take the maximum advantage out of these live lectures. How to deal with bad days? देखो, how to deal with bad days का पहला point ये है कि accepting that bad days will come. We tend to have a overreaction to bad days. The sadness होती है ना, जैसे आप मान लो आपका ब्रेकअप हो गया, अब आप सैड हो. You are sad because you had a breakup. After some time you are sad because you are sad. The fact that you are sad makes you even more sad. The same thing applies to bad days. If you had a bad day, if you could not study properly, you are feeling bad कि आज का दिन खराब हो गया, then you waste 2-3 days more that I wasted that day. So bad days are a part and parcel of preparation. They will definitely be there. And if you are having a bad day, stop studying. I mean, but every day cannot be a bad day, वरना तुम पढ़ोगे ही नहीं. If once in a while it happens, stop studying. Watch some movie, कुछ अच्छी मूवी देख लो, लगान देख लो, इस तरह भी कुछ मोटिवेशनल मूवी देख लो. And if you are not so much into motivational stuff, कुछ relaxing देख लो, right? Take a break. देखो, the worst part is you are not studying, you are not enjoying either. दोनों ही नहीं करोगे तो फायदा क्या हुआ? At least if you are not studying, take that day off. आपके brain को भी थोड़ा rest मिल जाएगा. But bad days will come. They are a part and parcel of the game, and we have to ensure that if there is a bad day, we take rest, and the next day we start again. If you are having difficulty in starting, start with something which is the easiest. Sometimes the best way to restart is to do questions. You are not able to study, do questions or see a recorded lecture. Start with a subject that you really like and you already know. ऐसे करके देखो. चलिए, anything else? भाई, for FMG sessions also, FMG students will take a session, आप चिंता मत करिए. हो जाएगा क्या हमसे भावी गर्ग? बेटा बिल्कुल हो जाएगा. करके तो देखो, सब हो जाता है. बस ये इंश्योर कर लो that for the next 110 days, whatever your capabilities, you are going to give your best. उसके बाद जो होगा देखा जाएगा. Because if you can ensure this much, if you can study for 100 days out of these 110 days properly, then you will definitely get selected. इतना ही करना है. वही जो इक्वेशन है, द इक्वेशन इज़ वेरी क्लियर. 9 out of 10 days, 10 to 12 hours a day if you're a post intern, around 6 hours a day if you are doing job or duties, and not stopping till 2nd March. This is the final equation. इतना करके देखो. फिर 3 मार्च को बात करेंगे. Study hard, get selected, and I'll be waiting for your messages on Instagram that you followed the plan, you got selected, and you're happy. Those messages give us real happiness every year. Every year it happens that multiple students, they always say that, sir, things were not going good, but then I followed the plan and I got a great rank. That happens every year. It will happen this year also. It will happen to you. All you have to do is take a step. आज से commit करो कि you are going to follow this plan and everything is going to fall in place. चलिए, let's complete this session. How many hours a day? 10 to 12 hours if you're a post intern. Alright guys, thank you for joining in, and it was nice discussion. And Apur Mehra sir, pranam. Again, I'll be seeing you in the app, and more importantly, I'll be waiting for your message on the day of result. It will be an honor for all of us to interview you. Please study hard, because we really want to interview you on the day of the results. God bless you.